Mesothelioma is an aggressive cancer directly linked to asbestos exposure. Predicting how patients will respond to available treatments is an active area of research, as it could help guide personalized treatment decisions. Several promising biomarkers are being studied for their potential to provide prognostic or predictive information in mesothelioma. One biomarker that is shown predictive value is epidermal growth factor receptor, EGFR. EGFR is frequently overexpressed in mesothelioma tumor cells. Several studies have found that high levels of EGFR expression correlate with poorer overall survival outcomes in mesothelioma patients. More importantly, from a predictive standpoint, multiple clinical trials have found that mesothelioma patients whose tumors express high levels of EGFR tend to see greater benefits from treatment with EGFR inhibitor drugs like erlotinib when added to standard chemotherapy. Measuring tumor EGFR levels via immunohistochemistry from biopsy or surgical specimens could help identify patients most likely to benefit from these targeted drugs. Another biomarker under investigation is tumor-programmed death ligand 1, PD-L1, expression. The PD-1/PD-L1 pathway helps tumors evade immune attack. In various cancers, expression of PD-L1 has been shown to correlate with response to immunotherapy using drugs called checkpoint inhibitors that target this pathway. In mesothelioma as well, several studies found that patients whose tumors express PD-L1 had longer overall survival when treated with a PD-1 inhibitor nivolumab compared to chemotherapy alone. Ongoing clinical trials are evaluating whether measuring PD-L1 levels could help select mesothelioma patients for treatment with checkpoint inhibitors. Mutations in the BAP1 tumor suppressor gene are very common in malignant pleural mesothelioma, occurring in about half of all cases. Emerging evidence suggests that BAP1 mutation status may be a promising prognostic biomarker in mesothelioma. Several studies have linked BAP1 mutations to more aggressive tumor behavior and poorer postoperative outcomes. Patients with BAP1 wild-type mesothelioma were found to have significantly longer median survival times compared to those with BAP1 mutations in their tumors. Measuring BAP1 mutation status could help provide patients with a more accurate prognosis and help identify those who may benefit most from more aggressive initial therapy or intensified follow-up. Another protein receiving attention as a potential predictive biomarker in mesothelioma is SADB2. SADB2 is expressed in normal mesothelial cells but is often lost in mesothelioma tumors due to epigenetic silencing. Recent research found that SADB2 expression was restored in mesothelioma cell lines treated with epigenetic modifier drugs like azacitidine. Furthermore, patients with SADB2-positive mesothelioma tumors had significantly longer median progression-free and overall survival when treated with azacitidine compared to those with SADB2-negative disease. This suggests SADB2 status could predict which patients are most likely to respond to azacitidine therapy. Further validation in larger clinical trials is still needed. Mutations in the NF2 gene, which encodes the tumor suppressor Merlin, are present in about 40% of epithelioid mesothelioma cases and are generally associated with the poorer prognosis. Interestingly, preclinical studies have found that mesothelioma cell lines harboring an NF2 mutation were significantly more sensitive to treatment with selinexor, a novel inhibitor of nuclear export. A currently ongoing clinical trial is evaluating whether tumor NF2 mutation status may help identify epithelioid mesothelioma patients most likely to benefit from the addition of selinexor to standard chemotherapy. While further research is still needed, biomarkers like EGFR, PD-L1, BAP1, SADB2 and NF2 expression and mutation status show promise for providing valuable prognostic and predictive information to help personalize treatment decisions for mesothelioma patients. As targeted therapies and immunotherapies for mesothelioma continue advancing, identifying reliable biomarkers may grow increasingly important for matching the right patients with the treatments most likely to effectively treat their disease.